Thank you, sir. Thank you, Kunal. Um, so you might wonder whether this is out of context, but this is mainly uh, included here just to highlight the importance of publications and what easier way than to write a case report. So we'll dive into the parts of a case report right now. So case report generally has three main structures. First, we have the introduction, then which explains the background of the case that you're discussing, and also you talk about the lacunae. And then we have the actual case presentation that we have, which includes all the patient information. And finally, we talk about the discussion. The discussion is actually a comparison of the previous cases that has been reported in literature, and you compare it with your particular case. So let us take an example. This is one of the case report that we published, and what we are going to do today is analyze how to modify our case report and how to make it better so that the acceptance rate becomes improved. So this is a patient who had acute lymphoblastic leukemia, and he was treated with systemic steroids, and later on he developed steroid-induced glaucoma. And this was published in one of the pediatric journals and not in an ophthalmology journal. So generally a case report can have somewhere between 500 to 1500 words, depending upon the journal which you are submitting. And the most important thing that you need to have in the background is have your introduction very focused. We don't have to talk about everything about ALL. We don't have to write a review article on ALL. So just focus on what is necessary. And then you talk about the lacunae. Now, how do you keep the introduction focused? So what are the points that we need to include in this particular scenario? So here, what we can talk about is what is the importance of steroids in the treatment of ALL. We don't have to talk about what are the different treatment modalities that we have for acute lymphoblastic leukemia. Just talk about what is the role of corticosteroids there. And then the next thing what you can talk is how many of them who are taking systemic steroids can develop steroid-induced glaucoma. And finally, you talk about the lacunae. So throughout this talk, what we are going to do is we are going to see 3-4 paragraphs and see how we can critically modify that. So we saw a beautiful presentation on how to make a PowerPoints, but I'm going to deviate here. I've put a very large paragraph. So this is mainly because we are only describing what is there in a manuscript, and we are going to try to edit it out. So this would be the first paragraph of the introduction. So I'll read it along, and you can read along with me and say whether it's relevant, necessary, do we have to keep it, or can we delete it? So the first line, ALL is the most common type of cancer in children. Do you think we need to have this here? So generally, as we already discussed, we are going to talk about the role of steroids in ALL. So the readers, we are expecting them to know what ALL means. So we don't need this information. Then in the next line, it describes whether it's a malignancy of B or T lymphoblast characterized by uncontrolled proliferation of abnormal immature lymphocytes and their progenitors. Again, a person who is going to read about ALL is going to know what it means. So again, this information is not required. And then the third line states, the corticosteroids have become an essential part of the successful treatment of childhood acute lymphoblastic leukemia. So here they are talking about the role of steroids in ALL. So let us have that there. And next, they are telling that for all children with ALL, induction consists of anthracycline, vincristine, aspergillase, and corticosteroid. Consultation consists of a variety of chemotherapeutic drugs. Maintenance uses 6-mercaptopurine or methotrexate, which is delivered once weekly or once monthly. Now, this is more like a review of what ALL treatment encompasses. And it is not so important in our context. So what we can do is we can delete this entire sentence, which is not necessary. And then they talk about what is the role of corticosteroids. Both lymphoblasts and non-neoplastic lymphocytes are susceptible to rapid lysis by glucocorticoids. So that's why you are giving glucocorticoids. So let us retain that also. And then survival rates after current treatment are now greater than 80%. Now this assumes a great significance because suppose the survival rate is just 10%, you're not really going to be concerned about developing steroid-induced glaucoma. Whereas if the survival rate is greater than 80%, you are more worried about the side effects. So again, we'll retain that. And finally, with the increased survival rates, attention should be turned towards improving the quality of life. So by telling this, you're justifying your presentation, your case report. So this improves the chances of it getting published. So this entire big paragraph can be consolidated into just 4 lines. So this helps in reducing the word count also, because we do not have unlimited space for a case report. Then the next part that you talk about is the role of systemic steroids. Role of is the prevalence of steroid-induced glaucoma when you give systemic steroids. So I have removed that for want of time. And finally, the last few sentences of introduction should talk about the lacunae. Now here, what we have told is studies describing steroid-induced glaucoma have mostly focused on adults, and there are very few reported in pediatric patients, although it constitutes 1/4 of all acquired glaucomas in children. So what you're doing here is you're highlighting what is not available in literature. You're saying that examining the eye is very important in those patients who are given systemic steroids. So this is how an introduction should go through. Now we'll go through the second paragraph that we are going to see. So this is a large paragraph of the case presentation. So again, I'll read it through and you can follow along with me. So this is a 6-year-old, and tell me what is wrong actually here. A 6-year-old male, Mr. Arun, was identified at one of our school screening ophthalmic camps with defective vision in both eyes. He was referred to a tertiary eye hospital for further evaluation. His uncorrected visual acuity is 6.9 in right eye, 6.12 in left eye. General examination shows good build nourishment for age. He weighed 23 kgs. Facial puffiness was noted. Ocular examination shows corneal haze, normal AC depth, clear lens, and ill-sustained pupillary reaction in the left eye. IOP is 58 in right eye and 64 in left eye. Gonioscopy reveals open angles in both eyes. Fundus examination showed a cup disc ratio of 0.8 in right eye and 0.7 in left eye. And we have quoted the figures also there. And OCT shows a marked reduction of average RNFL. Based on the above findings, we have diagnosed open angle glaucoma. Now, can you find out the errors in this particular paragraph? Firstly, there should be no patient identifiers. The name of the patient or any other thing should not be revealed. Secondly, we have included that just to highlight the importance of school screening also. So that's okay. And then what happens is his uncorrected visual acuity is 6/9. So these are patients who already come to your hospital. We have evaluated, done the investigations, they have gone back. Follow-up is also completed. So when you write these things in a manuscript, it should be in the past tense. So it should be his uncorrected visual acuity was. So whereas when you write a protocol for your research committee or an ethical committee meeting, it should be in the future tense. You'll write gonioscopy will be performed using 2-mirror or 4-mirror lens. Whereas when you write a case report or when you write a final manuscript, it should always be in the past tense because it has already been completed. Similar tense errors were seen in a lot of places. We'll just convert everything into past tense. And then because we are submitting it into a pediatric journal, we do not expect them to know what the normal intraocular pressure is. So in that case, we can also give the normal range. So we have mentioned IOP was 58 in right eye and 64 in left eye, but they might not be really aware what the normal intraocular pressure is. So we can put the normal intraocular pressure in parentheses. This is more important when we quote laboratory values. Say you want to highlight what is the total cholesterol levels. So these cholesterol levels are the normal cholesterol levels are going to vary between different laboratories. So always when we have laboratory values, we need to quote what the normal ranges also. So to summarize, like in a case presentation part, there should be no patient identifiers. It should be written in past tense, and we can include relevant negative history. So the most important differential diagnosis here is the presence of a juvenile glaucoma because it's bilateral. So in this case, we can specifically mention there was no family history of glaucoma, but we don't have to really mention like there is no history of pain, watering, redness, photophobia. It's not like we are writing an exam here. And we also have to discuss in chronological order. So we have started it with their first presentation. They came to the school screening camp, then they were referred here, then we evaluated, did the investigations, and then came the follow-up. So it should be like a story. And finally, if there are normal laboratory values, we'll include that. And the next part would be the discussion. We'll start with the positive findings of our study. And then we compare our case with those which is reported in literature. So here, one of the examples that we have, which is a shorter paragraph now. So Yamashita T et al. Conducted a retrospective review of 5 pediatric patients with ALL who received chemotherapy with repeated cycles of systemic corticosteroids, and they were followed up until the final cycle of chemotherapy, where symmetric IOP rise higher than 21 millimeters of mercury was observed in all patients. So firstly, when you quote people's names, you don't include their first name. Just last name et al. Is more than sufficient. And then it's a very long sentence. So there is no full stop in between. A single sentence is coming for more than 4 lines. So you try to reduce the word count of that particular sentence. So instead of writing conducted a retrospective review, you can mention Yamashita et al. Reviewed. But still you see it's up to 4 lines. So the next best option would be to break the sentence into 2 parts. So the ideal place to break the sentence would be at the location of conjunctions. So what you do is you just put a full stop and split it into 2 sentences. So this helps the reader to follow what you're writing. Though the initial information that you gave was clear, but because the sentence is very long, it is difficult for the reader to follow. So by splitting it into two sentences, it becomes more easier for the reader to follow. So then this is with regards to the case report. So what is the difference between a case report and a case series? As the name suggests, a case report is of a single patient, whereas case series have more than one particular patient. But again, this definition varies from journal to journal. So for example, IJO case reports say up to 2 cases can be presented as a case report, whereas Journal of Cataract and Refractive Surgery online case reports say up to 3 cases can be presented as a case report. And case series usually have up to 6 and up to 10 is acceptable for a case series. And how does a case series work? We just describe each case separately. So this would be case number 1. Like a case report, we describe all the features in a case 1, and then move on to case 2, and then move on to case 3, and goes on till up to 6 or 10, how many ever we have. But the thing that we don't do here is pull them together and find out the average. So what is the average visual acuity? What is the how many people presented? How many people who presented were males? So if we have to give all those information, so what is their age, average age? What is the proportion of males? How many had systemic illness? When we pull all their information and analyze statistically, it becomes a cohort study. So this is the difference between a case series and a cohort study. Now let us look at this particular example. So this is a patient who presented with redness around the eyes. Now it is very easy to prescribe some antibiotic ointment and send the patient. But when we removed the mask, we saw similar features on the tip of the nose. So this is Hutchinson sign, which is seen in herpes zoster ophthalmicus. So we also gave it a catchy name, unmasking herpes zoster ophthalmicus. But the problem is, for a case report, we can have 500 to 1500 words. But in this particular scenario, we don't have much to discuss for 500 or 1000 words. So what we can do is, we can convert it into a photo essay. A photo essay is similar to a case report, just that you just describe it in very short. It includes just 100 to 300 words. So there is one better way to do also. Suppose you have a very catchy photograph, you can just publish it as an image, which can be under different headings in different journals, either an ophthalmic image, or you can send it as a cover image, or it could be pictures and perspectives. So you just send the image and a very short write-up of less than 100 words. It still counts as a publication for you, and you don't need to put in too much efforts finding out references also. But the more important thing is, you need to have a good photograph. So this is a patient with candy stripe hyphema. We see light colored RBCs, which are lighter, which is floating on top of the fresh RBCs, which are more denser. So generally, when we write case reports, there are checklists. In fact, for any manuscript, there are always checklists. And for case report, it's called the CARE checklist. So each of they have like 13 subheadings. Under each subheading, they have mentioned what information is required to be put in a case report. So, for example, you see on the title, they specifically asked the diagnosis need to be followed by the words case report. So, in our case, the heading should have been steroid-induced glaucoma in a patient with acute lymphoblastic leukemia, a case report. So, if you follow all these checkpoints that we have in this checklist, the quality of our case report becomes improved and the chances of acceptance is much higher. And there are various journals which accept case reports, and most of these do not have article processing charges also. In fact, most of them do not have charges for publishing as a color image also. So it's better to use to publish in articles which do not have article processing charges, and most of these are PubMed indexed as well. And suppose in the worst case scenario, you submit your case report to multiple places, but still you get multiple rejections. The better option, the next option would be to publish it as a newsletter. It doesn't count as a publication, but it's at least better than lying idle in your hard disk. So thank you.